that. Melissa's here, Christine's here. Awesome. We have our functional neurosurgeon, of course, nobody else except for me. Today we have Dr. Michael Aminoff, who's come from UCSF. And the reason Dr. Aminoff is here as a visiting neurology lecturer is because I made that decision in 2020 when I was planning to try and convert Baptist neuroscience into something more academic. I think this is our 5th invited lectureship. Everybody that we've had has been, extremely well known in their respective fields, and the same for Dr. Aminoff. And because Diego Torres arrived on Monday to start as the Division of Neurology Director, I thought it'd be most appropriate if he did the formal introduction for Dr. Aminoff. Thank you.
Thank you so much, Michael. This is a true honor and an immense pleasure, really. Most people in academic neurology and academic neuroscience would be thrilled to do what I'm about to do. It is an immense honor to introduce to you Dr. Michael Aminoff. Many know him as MJ Aminoff because of the very famous last name in neurology and all of the things that he has done. He graduated from the University College London and University College Hospital as MBBS, and then completed his neurology training and neurophysiology at the world-famous Queen Square Hospital. And it is one of those dream places where neurologists would love to go visit and see. So much history and so much of what we do in neurology has happened and has come from there. Dr. Aminoff then came to the United States and has been working at the University of California, San Francisco for many, many years. And he has been instrumental in the building of the neurology department there, and beyond that, on the building of neurology as a whole. I truly believe that neurology would be different in the United States and in the world if Dr. Aminoff would not have done all the things that he has done. He headed the neurology board. He headed so many efforts in neurology education that he holds the most prestigious neurology educator award in the United States from the American Academy of Neurology. In all honesty, there are very few words that would describe Dr. Aminoff better than a giant in neurology. And therefore, we are so honored to have him here. Thank you so much for coming.
Well, after that remarkable introduction, for which I really thank you very much, the best I can do is now keep quiet. Thank you. And let me also thank Dr. McDermott for your invitation and for this named lectureship. When one looks back over one's professional career, there are obviously high points and low points, but certainly being here today and with this named lectureship is a moment of undiluted pleasure, so thank you. Having accepted your invitation to come and give a talk, I was then stuck with what to talk about. And what I didn't want to do was come and talk about neurophysiology to people who are immunologists, or try to talk about immunology, which I couldn't do, to neurophysiologists and so on. And knowing that this was going to be a mixed audience, I decided in the end to take a more general approach. And I'm going to talk about something that all of us think we know about, but actually we really don't. And that's the Brown-Séquard syndrome and sensory physiology in the spinal cord. But I'm going to do it by going over, first of all, the history of the syndrome. I'm going to tell you who Brown-Séquard was, and then what he did, and then how he changed his mind and nobody now believes what he said, although in fact, modern science holds that he was correct in his later views. I should disclose, first of all, that I have in the past written a biography of Brown-Séquard, which was published in 1993. I get no royalties at all from this book. You can still buy it on eBay for vast sums of money. I don't get a cent out of it. In 2011 or 2012, I published an enlarged biography of the same man, Brown-Séquard, published by Oxford University Press, and I do receive occasional dollars and cents from the press. So as I said, I'm going to tell you about the man and his career, then about his clinical and scientific achievements, then how he refined his theory on spinal sensory function, and then compare that with what we now know or don't know. So starting with the man and his career, this is a picture, it's one of the few pictures of Charles Edward Brown-Séquard. He died in 1894. When he died, obituaries were published all over the world about him. They were published in newspapers, in magazines. The International Congress of Physiology was in session in Rome at the time that he died. It immediately sent a telegram of condolence to the French Academy of Sciences, of which he was a member. The French Academy of Sciences had a 5-minute meeting in which this death notice was read out, and the meeting was immediately adjourned by the president out of respect for the late Dr. Brown-Séquard. Pasteur, shown here, is said to have cried when he heard that Brown-Séquard had died. This letter shows you with what regard Pasteur held Brown-Séquard. Dear Grand Master and friend, the letter begins. Well, who was Brown-Séquard? He was born on the island of Mauritius, which is between Africa and India. And he was born of an American father, a sea captain who was lost at sea before the boy was even born. So he was born fatherless. His mother was French, and he was a British subject. And the reason he was a British subject was that in 1815, the island of Mauritius was ceded from France to Britain by the Treaty of Paris, which ended the Napoleonic War. So he was born a British subject, and this had a profound influence on his career, as we'll see a little bit later on. As a teenager, he was unhappy and felt stifled in Mauritius and persuaded his mother to come with him to Paris, where he eventually enrolled in the Faculty of Medicine and graduated in 1846 after publishing a very, very exciting thesis that quite clearly the examiners did not understand, because if they had understood it, they would have failed him. In that thesis, he challenged the current concepts of sensory physiology. And we're going to talk more about that in just a little while. Over the following years, he became a very eminent and widely respected scientist. He was elected a fellow of the Royal Society of London, the oldest scientific society in the world, in 1860. Shortly after, he emigrated to the United States and was elected a member of the fledgling National Academy of Sciences of the United States of America. And some years later, when he moved to France, he became a member of the French Academy of Sciences. I thought you might like just to see his signature here on the book that fellows have to sign, signing their understanding of the obligations of fellows of the Royal Society. So here is Brown-Séquard's signature. Note that it's in the same column as Joseph Lister, the founder of antiseptic surgery, and also of Francis Galton, who was a remarkable polymath, as you know. He was a meteorologist, he was a psychometrician, a mathematician, a statistician. He was the person who introduced the use of twins to distinguish nature from nurture. he introduced the use of fingerprints as a means of identification. He is not popular or well regarded these days because Galton believed in eugenics. And after what happened during the Second World War, eugenics is something that is really frowned upon by many people today. Anyway, there is Brown-Séquard's signature to the Book of Obligations of Fellows of the Royal Society. Just so you can see, this was the notice that he received when he'd been elected a member of the Institute of Paris. How do I get rid of that top thing, I wonder? These are some of the positions he held. He was a founder physician of the National Hospital at Queen Square. In 1863, he resigned. His wife was an American. She was ill. There was illness in the family. Family came from Massachusetts. So he emigrated to to Boston, and got a position at Harvard as professor of physiology and pathology of the nervous system, the first professor of neurology in the world. In 1867, his wife had died. He was depressed. He was fed up with academic life in Boston. He felt he wasn't given his due merit, his due deserts, and he left, and he moved to Paris, where he was appointed in charge of the course of experimental and comparative pathology at the University of Paris. He could not be named professor because he was not a French citizen. Under Napoleonic law, you had to be a French citizen to hold a university chair. He resigned from Paris in 1872 after the Franco-Prussian War, and then there followed a period of several years where he wandered between the United States, Mauritius, his place of birth, and Europe, holding or being offered chairs in Glasgow, in Geneva, in Ireland, turning them down and becoming destitute. And finally, in 1878, Claude Bernard, the professor of medicine in the Collège de France in Paris, died. Claude Bernard and Brown-Séquard were rivals. The minute Claude Bernard died, Brown-Séquard rushed from the United States to Paris, became a French citizen. This is his citizenship document, signed by the President of the Republic, and then applied for the job of professor at the Collège de France, the most eminent medical position in France, and was appointed to the chair vacated by Claude Bernard, who had died. A little bit more about the man before we move on. He was married 3 times, had 3 children, founded 3 journals, one of which is still going strong, the Journal of Physiology in Paris, French journal. And he crossed the Atlantic more than 60 times. It is said that he spent 6 years of his life at sea. So apart from traveling around the world many times, what did he do? Well, let me just tell you about some of his scientific achievements. He clarified the sensory pathways in the spinal cord, and that's what we're going to talk about more in just a few minutes. Let me leave that for the moment. What else did he do? He emphasized functional processes in the integrative action of the nervous system. He pointed out that one part of the nervous system could excite or inhibit distant parts, and how those distant parts performed then depended upon the sum total of excitatory and inhibitory influences. Now, his experimental evidence to support this was really not good. You can read his papers, and they're really rather poorly formulated. And it was left to Charles Sherrington to really demonstrate that this was indeed correct. And Charles Sherrington got the Nobel Prize for this work in the early 1930s. He discovered the function of the vasomotor nerves. And just let me tell you briefly about the vasomotor nerves. In 1851, Claude Bernard found that if you section the cervical sympathetic nerve in rabbits, the ear becomes hot on that side. And Claude Bernard thought, wrongly, that the sympathetic nerves therefore regulate the local production of heat. That is incorrect. Brown-Séquard did exactly the same experiment in the same year as Claude Bernard, but he was traveling from France to Philadelphia at the time, and so didn't publish the work until 1852. Brown-Séquard's findings were identical to those of Claude Bernard, but in addition, Brown-Séquard stimulated the cut end of this sympathetic nerve. And when he did that, the hot ear of the rabbit showed a peripheral vasoconstriction. And so Brown-Séquard argued that the sympathetic nerves therefore control the caliber of the blood vessels. In other words, they control the physics of circulation. And that, of course, is the correct interpretation. Just out of your interest, on the right-hand side of this slide is shown a stimulator like we use in the EMG lab today. You can see how small and compact it is. On the left-hand side of the slide is shown the apparatus required to stimulate a nerve in the 1850s. This bit here fits on here. And you can see just how complex the equipment was to do the sort of experiment I've just told you about very briefly. And finally, Brown-Séquard was the father of experimental endocrinology and hormone replacement therapy. And anyone talking about Brown-Séquard has to say a few words about this work. So the father of experimental endocrinology, that claim is based on the following. In 1855, Thomas Addison at Guy's Hospital in London described 11 patients who during life had malaise, were anemic, they had rather curious bronzing of the skin, and so on, a variety of non-specific symptoms, but who at autopsy were found to have bilaterally diseased adrenal glands. They had tuberculosis involvement of the adrenal glands. Well, Addison published it, it's now called Addison's disease, published this in 1855, and immediately Brown-Séquard went to the laboratory and excised both the adrenal glands in a variety of laboratory animals and showed that the animals could not survive. Until Brown-Séquard did this work, the adrenal glands were thought to be vestigial structures of use to the fetus, but of no use after birth. So now Brown-Séquard shows that indeed they have some sort of vital function in life. Other investigators, nobody would believe Brown-Séquard. That other investigators showed, for example, that white rats survived the loss of both adrenal glands. And Brown-Séquard had to then go into the white rats and show that they actually had accessory glands. And if you remove the accessory glands, they die. So he showed that the adrenal glands are essential to life. What did the adrenal glands do? Well, at first, he believed that they removed the toxic chemical from the blood. After all, that they are next to the kidneys, and that seemed a perfectly reasonable thought initially. But then in 1869, when he was holding that, when he was running the course of experimental pathology at Paris, but not actually named as a professor, he said that these glands, the adrenal glands, have internal secretions and furnish to the blood useful, if not essential, things. In other words, he is describing a hormone. And it's based upon this work, remarkable work, very good work, very carefully planned, that he's regarded by many as the father of experimental endocrinology. But on June the 1st, 1889, something else occurred. Brown-Séquard was now aging. He's now in his early 70s. And as he walked the beach in Massachusetts, he became increasingly aware of his age. He would tire. He couldn't concentrate as well. His urinary stream was weak. He tended to constipation. He needed to have a nap in the afternoon. He decided that he was getting old. And he decided to inject himself with the mashed up testicles of rabbits, guinea pigs, and whatever. And that's what he did. And on June the 1st, 1889, he stood up in the Society of Biology in Paris and announced this. And he announced what happened. He felt stronger. He didn't need to nap in the afternoon. His urinary stream was more powerful. He was less constipated, and so on and so forth. And he suggested that this was worthy of further investigation. He didn't make any other claims for it. He published the details of his method. So that's what we've just talked about here. However, other people capitalized on his findings. This is an advertisement from the Strand magazine, an English magazine, published in 1912. And you can see all the various claims made for Sicard's elixir. It's down Sicard's effigy. None of these claims were made by Brown-Séquard. When he stood up and he made his announcement at the Society of Biology, a lot of people laughed at him. Newspapers started to publish cartoons of him. Here is a cartoon from the Figaro, the French newspaper, showing the newly built Eiffel Tower, tallest building in the world. And here is Brown-Séquard, taller than the Eiffel Tower, and stronger because the Eiffel Tower was aged, but Brown-Séquard would go on forever with his elixir of life, as they called it. Here is a cartoon from the American magazine. You can see Civil War veterans being injected with Brown-Séquard's elixir of life, particular extent. And here's one guy who's just had it. A lot of people made fun of Brown-Séquard, and others claimed that he was going to make a lot of money exploiting this supposed elixir of life. Actually, he didn't make a penny. He made his extracts available to everybody, to every scientist or doctor, free of charge. This is a label from one of his extracts. And when I say one of his extracts, I should go on to add that after he'd made his testicular extract and claimed benefit, he made a thyroid extract, a liver extract. He made a variety of organ extracts. And as you can see, it says at the bottom here, sent free by Mr. Brown-Séquard and Mr. Gasselbard, Brown-Séquard's sister. Now, under no pretext can this be sold. It was given away free by his laboratory in Paris. Within 18 months of this, there was the first treatment for hypothyroidism with thyroid extract. And this is the beginning then of hormone replacement therapy. So again, a remarkable achievement, at least in principle. Here are some other things that Brown-Séquard did. I'm not going to go through them. Let me just mention this, neurogenic pulmonary edema. Brown-Séquard noticed in his laboratory animals that an acute cerebral lesion seemed to give the animals pneumonia. Nobody took any notice. And then the First World War came along 30 years later, and French soldiers began to die following acute head injuries with pulmonary edema. And so this was first discovered by Brown-Séquard 30 years before the First World War. And now, of course, we all know the autonomic consequences that can occur following acute or with acute head lesions. So let me go back to the sensory pathways in the spinal cord. And let me just say that Galen showed that if you cut the spinal cord, there was paralysis below the level of the lesion and loss of sensation. If you did a cord hendisection, there was hypsynaptic paralysis, but Galen did not investigate the effects of a hendisection on sensory function in the laboratory animals. I think we'll miss that slide and the next slide out and just go to this slide. So when Brown-Séquard was a medical student in Paris in the late 1830s and the early 1840s, the prevailing view of sensory function is that the posterior columns were the continuation of the posterior roots, and that they were the main sensory pathways in the cord. Whereas the anterior columns were thought to contain the descending motor pathways. And that's what Brown-Séquard was taught. This is one of the few pictures that there are of Brown-Séquard. I showed you one earlier. This is another one. This is him in his 40s, so he was younger than this when he did the work I'm about to tell you of. And this is taken from his book, published in 1860, showing various lesions made in the spinal cord. And I'm going to show you now the simpler versions that I've made, like here. So remember I told you that the posterior columns of the cord were thought to be the main sensory pathway in the cord. Well, Brown-Séquard in various laboratory animals cut the posterior columns and left the rest of the spinal cord intact. And as you can see, there was no sensory loss. So that would not really jive with the posterior column being the main sensory pathway. In fact, there was hyperesthesia. Animals seemed overly sensitive to any thermal stimulus or pain stimulus. When in other animals he cut the entire cord except for the posterior column, there was sensory loss below the level. So these first experiments showed that the prevailing sensory theory was incorrect. And then he made other lesions in different parts of the spinal cord and showed that with the lesion involving the lateral funiculi, there was no sensory loss, but again, there was hyperesthesia. When he cut the anterior funiculi, he said that there was no marked sensory loss, implying that there may have been some. Then he did a hemisection from the back to the center of the cord, or from the center to the front of the cord, and found in both cases that there was sensory loss. So he concluded that the sensory pathways must reverse the brain out of the cord. And then he made his famous hemisection, his lateral hemisection. And what he found was that when he made a lateral hemisection, there was a loss of pain appreciation, particularly on the opposite side. On the ipsilateral side, there was paralysis of the leg, and there was hyperesthesia, that sensitivity that I told you about a moment ago. So Brown-Séquard concluded that the sensory fibers must cross from one side of the cord to the other. When he made hemisections at one side and then on the other side, he was able to show that these crossing of sensory fibers must occur very soon after they enter the spinal cord. And so we come to what Brown-Séquard and others now believe, which is the sensory fibers come into the spinal cord, and then they synapse in the posterior horn, and they cross to the other side, and they ascend in the anterolateral or the anterior funiculus of the spinal cord. Some go up to the posterior column, but the pain and temperature here. Brown-Séquard followed up this work by very careful study of humans, patients with spinal cord injuries. And he came up then with what you and I would now describe as the Brown-Séquard syndrome. So here is the anatomical pathways up here. Now the syndrome, on its side opposite where the lesion was made, there was a loss of pain and temperature appreciation. And on the ipsilateral side, there was paralysis, plus an impairment of position, sense, and vibration. But in addition, and something which most textbooks of neurology never mention, there is hyperesthesia on the ipsilateral side, spontaneous pain on the ipsilateral side, and itch on the ipsilateral side. And most of the books don't mention this because they can't explain it. Over the following, so now we're going up to 1892. So over the following 30 years, all doctors came to believe what I just told you. And many still do, of course. So believe what I just told you. And the Brown-Séquard syndrome was born, was established, and came to be widely believed. Until 1892, when Frederick Mott published his experiments in monkeys. Frederick Mott was the man who founded the Maudsley Hospital in London, a famous psychiatric hospital in London. He was also the man who showed that GPI is due to neurosyphilis. In 1892, he reported on experiments in monkeys, and he found that hemisections, lateral hemisections, produced pain localization contralaterally, but pain was lost ipsilaterally. Now that's the exact opposite of what I just told you. So it raises the question, is there a Brown-Séquard syndrome? What are the consequences of a lateral cord hemisection? And if there are consequences, what are they due to? So let's now go on to how Brown-Séquard refined his theory. Here is Brown-Séquard in the late 1880s. This is a drawing taken from Harper's Weekly, showing Brown-Séquard lecturing at the Academy of Sciences in Paris. A very distinguished man. His career was made on his sensory physiology experiments. And here is this young upstart in London, Mott, saying that he got it wrong. How did he respond? Well, 3 months before he died, in 1894, he published a 5-page paper in response to Mott's paper. He began by praising Mott's work. He then pointed out that he had revised his own views 15 years earlier, and he had published his revisions. He now doubted that cutting a hardwired system explained all the findings that you encounter clinically. He showed, for example, that a small lesion in the posterior column of the cord, a pinprick, could actually produce contralateral analgesia, loss of pain contralaterally. Again, if there was contralateral analgesia after a cord hemisection, stretching the sciatic nerve on that side, i.e. changing the afferent input to the cord, could abolish the analgesia. And then he did this remarkable experiment, absolutely astonishing. He made a cord lesion, a cord hemisection, and got the Brown-Séquard syndrome, right? He then made a second cord lesion on the same side, another hemisection below the first one. And guess what? The sensory findings reversed. The analgesic side became hyperesthetic, and the hyperesthetic side became analgesic. Now, you're cutting, if you believe you're cutting telephone wires, you're cutting the same wire on both, first up, down, up here, and then down here. So just cutting the telephone wire cannot be the explanation for the findings I've just told you about. Brown-Séquard thought that maybe the analgesia or anesthesia from cord lesions related to inhibitory processes occurring in the spinal cord on the central sensory pathways, and that the hyperesthesia related to excitatory effects on those central sensory pathways. Well, what's happened since then? In 1991, I was actually writing that first biography I told you about, Brown-Séquard, and I was really puzzled by this paper I just told you, 5-page paper, which is astonishing experimental findings that nobody seemed to know about or care about. And so I wrote to Pat Wall, who was professor of anatomy at University College London when I'd been a student years before, and a famous pain researcher. And I asked him, what did he think of this thing? And this is what he wrote back to me. I hope the clerks will help you. I read the 1894 paper and one of the most important in neurology. Most neurologists have never heard of it and would be incapable of understanding it. But what he did do was he sent me a reprint of an article by Denny Brown. Denny Brown was a very well-respected professor of neurology at Harvard at the time, the Massachusetts General Hospital. And this is what Denny Brown had published in 1979. He'd made lesions in the thoracic cord of monkeys. With an incomplete hemisection, he got a typical Brown-Séquard syndrome. With a more complete hemisection, it reversed. And he got that's called a Mott syndrome. With ipsilateral analgesia and contralateral hypoesthesia. More interestingly, he did a similar experiment to what I told you about his cardiac. He made a hemisection of the spinal cord and got a typical Brown-Séquard syndrome. Then above the first lesion, he made another lesion. He either made a more complete hemisection, or, well, let me stop there, made a complete here, and he found that the contralateral analgesia was replaced by hypoesthesia. And ipsilateral analgesia, in other words, was able to reverse the Brown-Séquard findings to cause a Mott syndrome by simply extending the lesion. Now, if you look carefully at the drawing on here, you can see that the anterior column is not completely cut. Here it is. When he extended the hemisection even more to involve both anterior columns, sensory responses in the monkeys returned bilaterally. So here is an animal with cord lesions, which then first lose a cut sensation, and then sensation returns to on both sides. And this is by Denny Brown, a very, very respected neurologist. And so Denny Brown thought that the fibers in the anterior column have an inhibitory effect on spinal mechanisms, which is balanced against an excitatory effect produced by fibers in the anterolateral. See, he again now thought that there was a balance in the spinal cord of excitatory and inhibitory effects. Now, what about more recent work on the spinal cord? Well, recent work has shown that both descending fibers and afferent coming into the cord fibers can influence sensory deficits after cord lesions. The neurons in the brain stem can turn the neural pain mechanisms in the spinal cord off or on. Knowledge about the precise circuitry is still unclear. So here is what we saw before, the spinal cord with the fiber coming in, synapsing in the posterior cord and crossing to the other side to the A7. And here are various regions in the brain stem where, depending on exactly where you stimulate, you can either turn on or turn off the dorsal horn here. And you can turn the spinal pain mechanism on or off by stimulating in these various brainstem regions. So Brown-Séquard found that sciatic nerve stretch or posterior column lesions can also affect pain sensation. And we now know from clinical studies that if you do a cordotomy on patients, for example, to relieve pain, after a while, the pain commonly recurs. Why or how? Could local afferent or intraspinal circuits be responsible? Well, this is a cartoon that I borrowed from Alan Bascom, who is chairman of anatomy at UCSF. He and I have had long discussions about what we were talking about. Here is the Brown-Séquard syndrome. See, there's a cut here, interrupting the pain pathways going up, and there's contralateral analgesia. Here, in the spinal cord, there's two cuts. So a double area section, and there's a loss of the pain at this talking about. Let's go over here. Here, you've got various interneuronal circuits within the spinal cord. Here's the original one going up, giving off synapses here and here to another ascending system, and then flossing back. And so you can come up with these interspinal circuits that can carry pain information from one side to the other side of the cord, so that you can still feel pain even if the original ascending pain pathway is cut. We don't know the precise details of this, but increasingly, this is what appears to be the case in the spinal cord. So Brown-Séquard's final concept of sensory physiology, and specifically of pain physiology, is not far removed in principle from views that are now evolving among modern neuroscientists. It's more than simply cutting a telephone wire. Changes in dynamic cord mechanisms seem to bear also on the altered sensation that results from cord lesions. So you may say, sort of, so what? Or what are the implications of all this? Can sensory deficits be reversed by making new lesions in the spinal cord? How confident can we be about the precise localization of a cord lesion by clinical exam? You know, do we need more clinical correlation studies, and I believe we do, to try to clarify sensory changes with anatomical sites of lesions in the spinal cord? Well, Brown-Séquard died in 1894. There are very few mementos of him. There are a few in Mauritius. There's a psychiatric hospital in Mauritius also. There's a street in Paris named after him. In 1972, the Paris Mint issued a medal commemorating Brown-Séquard. On the side of the medal here are listed many of the things that he did. Opioid therapy is hormone therapy. But I think my time is up, and I will stop there, and thank you very much for.